Good afternoon, and welcome to Enabling Asset Tracking and Facilitating Clinical Workflows with Person-Centered RTLS, a health system CIO Media Inc. production sponsored by Sonitor. A little housekeeping before we get started. My name is Anthony Guerra. I'm the founder and editor-in-chief of Health System CIO, and I'll be your moderator today. We're looking forward to your participation. You can send in your questions and comments anytime in the Q&A box, and we'll take those later in the program. Just so you see how we're going to spend our time today, first we're going to go about 35 or so minutes with our main panel discussion featuring Joel Vengco, Chief Information and Digital Officer with Hartford Healthcare, Niel Oscarson, Research Director for ERP, Healthcare Operations, Credentialing, and RTLS with KLAS, and Teresa Brasac, Chief Clinical and Informatics Officer with Sonitor. And then we will have our Q&A. So let's jump right in. Joel, let's start with you. Can you give us a little bit about your organization and your role?
Sure. So as the Chief Information Digital Officer, basically I focus on all things data and digital and strategy around technology use and adoption. And really our vision at Hartford Healthcare is around being the most trusted and personalized coordinated care. And that has a lot to do with the foundation of a digital and a data organization. So, my role is really focused on putting Hartford Healthcare in the hands of our members across the state of Connecticut. We have roughly 500 sites across Connecticut, continuously growing and expanding. We're about a $6 billion organization. And the organization itself has really begun to do a lot of great work in innovation, particularly as it relates to not just technology, but also the way that we deliver care, the way that we get reimbursed for care. So we've really focused on value-based care quite a bit recently. But also, of course, there's this thing called AI that's out there, and everyone wants to take a little bit of a piece of it, and we value our innovation work, and certainly that's some of the stuff that I've been helping to really progress forward in our organization. But ultimately, Hartford Healthcare is the premier healthcare system in the state of Connecticut. But also, I'd like to just say that I'm proud to state that HHC, Hartford Healthcare, is one of 3 organizations that got straight A's in Leapfrog this year. I'm really proud of that, and that accomplishment has been long-standing. It's been a lot of work. So thanks for having me on.
Always, my friend. Thank you. Niel?
Yeah, great to be here. Niel Oscarson, Research Director for KLAS Research. For those who aren't familiar with KLAS, our goal is to provide transparency around healthcare IT decision-making. So executives like Joel can have access to the KLAS data to get a view on performance. And all of our performance ratings come from experiences of current customers. And so in my role at KLAS, I get the opportunity to think about how we best represent technology and research around areas that we hope are influencing operational efficiency. So love the topic today about how RTLS can be impactful in clinical workflows, and more with margin pressures and staffing challenges. I'm thinking deeply about what technologies are enabling optimization and efficiency in healthcare operations and can be impactful. And we hope that what we share is validated experiences of live customers. So that we always hope that the KLAS role is to cut through the marketing speak down to these are actual experiences of live customers with technology. So I will try to come with that perspective today, and really appreciate the chance to talk about an exciting topic.
Excellent, Niel. Thank you. Teresa?
Sure. Good afternoon, everyone, and thank you for having me. My role is Chief Clinical and Informatics Officer for Sonitor. And Sonitor is a leading provider of what we like to call affordable, accurate, and easy-to-use RTLS, real-time locating. It's actually the first and only company to design and engineer low-energy ultrasound technology for real-time locating purposes. So with 25 years of innovation, to over 250 patents and patents pending worldwide, we have over 300 installations in 3 continents. And I'm very, very proud to say that we were rated best in class for RTLS for 2024. In addition to our ultrasound-based RTLS, which we call Sonitor Sense, we also offer a BLE solution, Sonitor Blue, and a mobile device locating solution, which we call Sonitor Mobile. All three solutions can come together for a variety of use cases that obviously we'll be discussing today. And I'll be providing, I've had over 18 years of experience implementing technology at the bedside, particularly RTLS. So I'm very passionate about what RTLS can bring to healthcare, and I'm hoping to share that with you. Out of all the devices and all the technologies that I've had the opportunity to implement with big healthcare systems, one of the ones that I think brings the most to the table is definitely RTLS from a data perspective. And then lastly, and probably most important and most exciting to me, is that Sonitor is entering into a new innovative and commercial excellence phase in its history, where we're really focusing on enabling hospitals to optimize multiple technologies within one platform and make it affordable and scalable, providing indispensable data to the business of care delivery. And within my role, I really work with engineering, R&D, the commercial arm, and then with our larger customers to really help hone in on what is this data that is driving some of these automations and clinical workflows and efficiencies within hospitals. So thank you for having me.
All right, very good, Teresa. Thank you. All right, Joel, we're going to start with you. What are some of the challenges in healthcare that RTLS technology can address? And you know, if we want to bucket these into sort of basic use cases, perhaps advanced use cases that um, maybe would take some time for an entity to get to, maybe, you know, walk before you run type thing. And then if you want to clear up any misconceptions, we want to make sure people know what this is good for, where its strengths are. But perhaps there are some areas that people might think they want to use it, that it may not be the best solution. But your general thoughts there.
Sure. You know, so when I think about RTLS, I sort of think about it in really three big buckets. The first is, you know, monitoring or tracking. The second, and I think, you know, Teresa touched on it, is around analyzing the data that comes, you know, from RTLS. And then there's this notion also of alerting, you know, or providing, you know, insights as in alerts to those that you know, are looking to be alerted on certain things that I'll talk about in just a second. But you know, those are sort of the broad buckets that I sort of focus on, that we focus on in terms of using RTLS. I'd say, you know, some of the entry level use cases that people talk about, and you know, we've certainly dabbled in, has been on asset tracking, sort of first and foremost. You know, real-time location with that kind of specificity. You know, you'd want to be able to track things like, you know, medical devices, or like pumps, or even wows, or beds. You know, those are, you know, kind of entry-level use cases that we've seen very successful, particularly as we, like, you know, try to monitor and manage those assets, where, you know, we'll find pumps that left not only our campus, but went to Massachusetts, you know, from Connecticut. Or you'll see them in different facilities. I mean, they get placed on ambulances along with the patient, and then, you know, you're not able to find them after that, or they may get hidden in a closet. But, you know, to be able to track those assets, to know, you know, what you can replace, or what you need to replace rather, or what you can, you know, put back into the fleet, is really important to make sure that, you know, again, you've got access to those assets readily, and you don't have to continue to buy, you know, perhaps assets, you know, over time, because you're losing them. And of course, tracking them is important. You know, we also started to focus on what I'll call employee safety, colleague safety. You know, the wearable tags that have RTLS that can enable staff to you know, to alert our physical security team if there's a violent patient, or if there's you know, situation happening. That's been, you know, a long-standing issue for us, and I know for a lot of healthcare organizations, particularly depending on where you are from a you know, location perspective. You know, that's something that we certainly have been focusing on using RTLS for. We can certainly drill into that a little bit more. Also, we've started to look at obviously patient flow, staff flow, and monitoring, tracking. not just from a an efficiency perspective per se, and sort of process analysis perspective, but as we think about engaging patients in a better way, improving our workflows, improving the experience of the patient. We want to know that a nurse is in effect, for example, rounding around the unit and seeing patients every 10 minutes, greeting family members in certain locations. Those are things that have been very helpful, to us with the use of RTLS, and what we're hoping to continue to expand RTLS for. And finally, the monitoring piece, the temperature monitoring, motion, environmental monitoring. Those are things that are also, things that we've been in pockets and pieces dabbling with. And by the way, the reason why I say pockets and pieces and dabbling, I want to make a point, with the acquisitions that we've made over the last several years, of course, when you look at the products that are out there, you realize that there are a lot of different vendors that have come in to this organization. And so, our RTLS strategy right now is to look at unifying our platform, unifying perhaps even the vendor landscape that we have, rationalizing those, so we can ensure that not only do we have good control over the platform that we're leveraging, but also good control over the data, standardized data, so that we can start to leverage that for analytics more broadly. So hopefully that helps.
Yeah, very good, very good. Neil, what are your thoughts about the question or what you heard from Joel?
Yeah, great response from Joel. And a few things I might add to that. I think the well-established use cases around asset tracking are real, and there's real advantages to them. I think that for RTLS to show its true potential, we have to build off of those into some other areas. And in my role at KLAS, I'm thinking a lot about healthcare operations. And as we've done research with CIOs and others, there's a lot of conversation about two kind of main things, a lot of them driven by staff challenges. So if I have less staff, how do I manage my health system in a more efficient way? And then the other question is, how do I provide an environment that nurses want to stay longer? And at first glance, it may seem like RTLS doesn't impact those two areas very much, but I think there's some interesting use cases where they can. Joel mentioned nurse duress. We are seeing in our research that organizations who have a robust nurse, or I shouldn't say just nurse, staff duress process, and often that involves RTLS, a tag where they can push a button and get instant reaction from security or others, helps nurses feel safer, and it can help with impact around the environment and longevity of nurses. And I think even more than that, I think there's really interesting workflows that can be impactful to the operations of a facility. You think about just the experience we've all had of sitting in a waiting room, going in for a checkup or an appointment, sitting in a waiting room, waiting for somebody to check me in, versus perhaps grabbing a tag as I go in, picking my own room, and then that RTLS just checks off it starts a process. They know where I am. Somebody could bring me the information I need to fill out my form, or the nurse knows they can come in and give me my initial check. There's just some opportunities to make the experience of the patient much more of a easy kind of flow than we've had in the past. I think that's where the next phase of RTLS will be really impactful, and hopefully become more efficient. Use our staff in hospitals and in clinics more efficiently, because these flows just happen automatically. Even things like triggering room cleaning can start the second somebody leaves the room, right? Nobody has to go check a box and say, come do this. Those may be marginal improvements, but they all add up in a way that I think can be impactful. So to kind of summarize, I do think asset tracking, temperature control, all those still have very impactful uses. And I don't know that the adoption is as high as it could be in healthcare. But the next frontier of use cases in this space, I think, can be impactful in the very areas that we are all kind of facing daunting challenges in.
Excellent. Teresa, what are your thoughts?
Yep, great. And just as a follow-up, just two extra things here. So we talked about some basic use cases and then some advanced cases. I think one of the things that need to be taken into consideration in both of these kind of use cases classifications is the level of accuracy that is needed for these. And there are many RTLS vendors out there, of course, with different technologies, and we'll get into that a little bit, a little further in the conversation, I believe. But there are a limited number with high accuracy resolution. And so with high accuracy resolution, and I believe that you could get to these advanced use cases quicker and more accurately, and then expand on them. For instance, and Neil brought up some explanations, but I'm a real big fan of RTLS integration into nurse call. It facilitates a lot of the workflows. Even at a very minimum, when a nurse walks into a room after a patient has called or alarm has gone off, that automatically, that RTLS senses that that caregiver is in the room, and it automatically cancels that call. I can't tell you how tedious it is to cancel a patient call. It seems so simple, but it does require many times to go behind the bed, around the equipment. I recently had a coworker videotape me canceling a call, how long it actually takes. In the meantime, that call is open and it's making noise throughout the unit. Others don't know that that call's been answered. So something as simple as walking into a room and canceling a call really alleviates the workflow from a caregiver. Going back to Neil's point about retention, that is one of the functionalities that's really liked by nursing. So I believe the accuracy is an important consideration here for the use cases. The second point here is, what do you integrate with, right? So we talk about asset tracking as a basic use case, but really it becomes a workflow and even borderline advanced use case when you integrate to certain systems like CMMSs, right? Or I recently did an integration with NRAC. I don't know if you're familiar. It's the National Recall Alert Center, where if we receive an alert that there is a recall on a piece of equipment, it automatically scans through the list of equipment, finds the piece of equipment, notifies that cost center, that the director, that that piece of equipment has been recalled. It actually takes away 5 or 6 different steps. So even at its basic use case, when integrated with the right systems, could be a huge application.
Yeah,
And if you
Teresa.
don't mind, just
Oh,
really
go ahead,
quickly,
Niel, please.
Teresa, I love that you mentioned the nurse call, the automatic call cancellation. I'm really glad you mentioned that. I think there's 2 elements to that I've heard from hospital executives that they like. One is just the time, right? You mentioned that very well, Teresa, just the time. The other one, more and more, is for nurses, it feels like an incredibly professional environment when I am in a world where they care about my time enough that I don't have to do those kind of elements. And those signals are really important today in a world where it's a scarce resource.
Yep.
I would just add, actually, Teresa, thanks for those use cases. I think an important point that you brought up from a paradigm perspective is that, RTLS can kick off a variety of other, workflows. And if done well, to your point, it can really, begin to reduce some of the, some of the more sort of rudimentary tasks that, could be automated, could be kicked off by simply somebody entering a room, or a patient, coming to the registration desk and kicking off workflows that the registration, the front desk person can start to do with them, whether it's asking them specific questions or providing them with specific steps for the procedure. But I think to your point about the advancement of RTLS as a kickoff for other workflows, it's just a terrific way to look at it, because it solves a lot of problems, not just tracking an asset, but perhaps even kicking off another workflow as a result of tracking that asset.
So when Teresa mentioned this concept of canceling the nurse calls, I thought of this expression, and you guys may have heard of it, removing pebbles from shoes. Have you heard this one? The concept of, and I guess you could be talking about IT. Having pebbles in your shoes is annoying, right? It's irritating. and you want to remove the pebbles from your user's shoes. So I've heard this in the context of a problem like that. Like you deal with that, and Teresa, you said can create a lot of goodwill with, as Niel said, these individuals that there's a lot of retention issues around. So something as small as facilitating this removal from their shoe, taking this pebble out of their shoe, can go a long way in retention. I'd like to hear everybody on that, but Joel, maybe you first.
Yeah, I mean, for again, I think for let's take a different different segment of our organization. I mean, it's still clinical impacting, but our supply chain folks, when their use of RTLS and RFID and automation, and sort of in total, has enabled us not only to find things in the warehouse much more quickly and rapidly, but it also helps us to track supplies that are either aging or they need to be replenished, et cetera. But when we look at our sort of pre and post supply chain redesign using RTLS, not only was it a slower process, a more inefficient process, it was the pebble in the shoe for the clinicians who were ordering the supplies, for the folks who are running to get the supplies and looking for them on shelving that's not necessarily well ordered. And now we're still in the midst of fully implementing it across the enterprise. Those that have implemented are seeing significant improvements in workflow, access to supplies more rapidly, creating the preference cards more quickly pre-procedure. So those are things that I think we've seen as a kind of a benefit of being able to identify the location of a specific asset or a specific supply. So it's certainly helped with that.
Niel, anything else you want to add on that?
Not a lot. I actually really like your analogy of the pebbles in the shoe. And I do, I'm going to overstate this case, but I'm going to do it on purpose. But I think for years we kind of we have all said, hey, nurses are an infinite resource. If we don't have enough, then we can get travel nurses, or we can get contingent staff or whatever. And again, I don't mean that with any disrespect. Everybody I think all executives know the importance of nurses, but there's been an opportunity to tap into other areas if we need to. And I think post-COVID, the reality now is we have to think very deeply about the experience, about how many pebbles are in the shoes, and not just for their experience, but for the efficiency gains that come. I mean, that pebble analogy applies to operations as a whole. The more pebbles that we get in that we can remove, the smoother the entire process is. So mostly just a validation that I think that is real, and I think RTLS is one of the areas that can have a significant impact.
Teresa, anything else on that?
Yeah, real quick. So two kind of examples from an operational perspective, although I am representing the clinical world, right? I have hundreds of those. But from an operational perspective, you think about a Lean Six Sigma process and really having visibility to anything that affects a throughput process. And I believe RTLS really gives insights that no other can. For example, we know it's important to kind of turn over those rooms, right? We know that there are times during the day where there's delays getting patients discharged. So very simply using RTLS for an auto discharge functionality where the patient's wearing a tag, and once that discharge occurs, the nurse can place it into a box, and that just starts a whole process efficiently to turn over that room. And we're using a lot of RTLS in OR workflow, specifically around first case starts and room turnover. So just having staff with locators and equipment with locators, we're able to enhance the communication among staff and to track process in that OR workflow. And we've had some successes where we've added overall 1 to 2 cases per OR working day, which is significant when you look at 4,000 to 6,000 per case that'll bring in. So even in areas where we're not thinking that RTLS can improve performance, it really does.
All right, very good. I want to drill down on the technology a little bit. Probably hear from Teresa and Neil on this, and Joel if you want to. But I think one of the ideas that we want to address here is that RTLS, there's different types of RTLS, right, Teresa? It's not all created equal. There's different flavors, different varieties, different levels of specificity and location finding that will have a big difference in the results you get and the use cases that you can operationalize. And that also it's quite different than perhaps it was even 3 years ago, right? So if you looked at it 3, 4 years ago, you may be operating on false assumptions that could be different today. The value proposition could be different. But Teresa, if you want to just give us a real quick kind of education on different types of technologies, get into the buyer's mind, like someone in Joel's position who's about to hit the market, what would be your quick tutorial?
Yeah, and I take it from a clinical perspective. So clinicians are pretty technical, I consider, since they're on an EMR typing away all day. However, I try to keep it simple. So from my perspective, there's really three driving technologies within the RTLS world, right? We're all very familiar with light and radio, and then ultrasound, which is ours. And even within those areas, there's a different type of subcategories, whether or not that technology is truly high precision, meaning it's very fast. I call it the speed of a nurse because they really do not have time to wait around to see if their RTLS is working. I've experienced that firsthand. And then accuracy level, right? Do we need the accuracy level within a room, within a bay area? And so different technologies will respond better to those use cases than others. For instance, sound is self-contained within the four walls of a room. So it doesn't pass through glass, it doesn't bounce. And so what we have been seeing in the marketplace is kind of a combination of a variety of these. So you could have radio technology with light to increase kind of the accuracy or reduce, really, if you want, the bouncing of it or the inability to contain. So we do see where there is a combination of some of these technologies to help improve the accuracy level. The concern with that is that in order to do that, then you need more devices. So that's a consideration. But I always go back to what is it that you need the RTLS? What are you trying to accomplish? And then from there, what is the technology that will get you there most cost effectively?
Excellent. Neil, anything you want to add on that?
No, Teresa will do a much better job of explaining the actual technology than I will. I will say that there is as she mentioned very well, there is a precision element here. And generally with more precision, you are adding on implementation and other costs. And so thinking about many of the workflows that we are interested in require at least room level precision. Some of them even more than that. You think about like an infusion center, you almost need like chair level precision to do some of the workflows. And so thinking deeply about the trade-off between the workflows that I would like to implement with the cost of equipment and implementation is really important. And I think there are some good partners. Sonitor is one of them in this space who you can have that conversation with as a hospital. But I think it's always smart to start with adoption and use cases in mind, and then buy the technology that will drive adoption versus thinking technology alone and then figuring out adoption and use cases afterwards.
So Joel, I am going to come to you on this, and I'm not going to ask you, for a level of specificity that may be the kind of thing you assign to someone, meaning I want you to go investigate RTLS and get really into the weeds. That may not be what someone in your position is doing, but you have to know enough to be dangerous, right? You have to know enough to sort of get out there. And one other thing came to mind. We talk about buying for use cases, and that makes sense. But if we talk about this progression of walk or crawl and then walk and then run, we don't want to not be able to move forward on a use case that we might want down the road because we bought for a basic use case. So how do you future proof? Any thoughts around this stuff?
Yeah, it's a great question. So in my situation, I've been at Hartford almost 2 years now, and what we discovered is that, the vendors of the RTLS technology they're pretty good at selling, obviously, because they pique the interest of many of the clinicians. And I think they identified some of the things, some of the problems that the clinicians wanted to solve. Like I said, the nurses are looking for their beds or their pumps. The orthopods are looking for ways to track patients as they go into pre-op. And so we've seen all of these use cases kind of emerge, and there are a number of RTLS vendors that we now are employing to do some of these capabilities or achieve these capabilities. But to the point of my colleagues here, there's a level of precision and specificity that can only be addressed with certain types of technologies that you implement, and some of that fundamentally starts with your network, your Wi-Fi. Are you going to use ultra wideband, or are you going to use 900 megahertz type of connectivity? And if you're in my shoes, for example, having just inherited all of this infrastructure, and we're thinking about renewing, for example, our network infrastructure, which we're doing now. These are the considerations that we're talking about. If we're going to go beyond some of the basic use cases that RTLS at sort of an asset tracking at a general level would require, and we really get into more precision-based location, and maybe layering on top of that more advanced analytics, and it will require different infrastructure and capabilities. And so obviously you can only future-proof so much, but as we start to think about refreshing and redesigning our network as sort of a first place to focus, we're thinking about that kind of specific connectivity, so that we don't find ourselves in a place where we're going to have to re-implement additional access points, or try to figure out ways to to plug in beacons in places that we didn't expect to plug them into. So so a lot of that is happening now, and I think many organizations, as they build or as they refresh infrastructure, should start to think about, to your point, the future proof of those components. The last thing I would add is we also look for partners, vendor partners, who have the ability to integrate into not just current network infrastructure. Some have direct API connections to the vendor that we've chosen. I won't name the vendor, the network vendor, but they're direct APIs into that vendor. They also, some of these vendors also have more of an open platform that enable them to connect perhaps to other devices that we already own. And so some of those considerations, as you think about vendors, would enable you to at least future-proof, or at least integrate more broadly into an ecosystem that you might already own or possess.
Excellent. Thank you for those points. Teresa, real quick, on some of what Joel was saying, can you offer any thoughts about the relationship between RTLS and the network? And I don't know if you ever get called into an organization that wants to have a conversation, and you find out about their network and infrastructure, and you say, you guys are going to have to do some work here in order to take advantage of the technologies we're discussing.
Yeah, so I'm going to comment a couple of things that Joel brought up, which is, Joel, you represent the majority of our customers, right? They are facing exactly the same situations that you've mentioned, and are taking into consideration many of these, I don't call them hiccups, but challenges, and how do you future-proof your technology? And so, interesting enough, I look back over the years, has there been any innovation in RTLS truly and really? And this is one of the reasons why I came to Sonitor. I left a position that I was in for 16 years, very excited about the future of Sonitor. We talked about our three major technologies, with a new technology coming out named Sonitor 1. And this will require just one device, one platform that will support 6 locating technologies, from the back end, from the network, and then also from the locating technology. So reducing all this infrastructure to just one device per room that can handle different types of backend and locating technologies is really what got me excited about allowing or providing affordable scalability to this very rich data. I like to call it pick your tag, pick your locating technology. So just with one device, I can do zonal BLE, I could do bay level locating with ultrasound, I could do the mobile device locating and from a back end BLE or Wi-Fi or our own gateway. If you don't, to your point, Anthony, if you don't have a strong enough network, we can kind of fill in with our own gateways so that we don't necessarily have to write off of the network.
All right, very good. Let's talk a little bit about ROI. Hard ROI projects have always been probably in favor. But as you know, the tougher times are, the more important having hard ROI is. Can RTLS be considered one of these? Do you have any advice around demonstrating the potential for hard ROI when pitching an RTLS project or showing ROI achieved post-implementation? CIOs often have to balance leading versus supporting. I've had a great conversation on this earlier in the week with some individuals, how this is really more of an art than a science. If the CIO feels RTLS can help the organization, even if it has not been requested by users through formal governance channels, how and when can it be championed or pitched? Niel, I'll get to you in a second, but I got to come to Joel on this first. Joel, this is the balancing of the CIO. We don't want to be taking orders, and we don't want to be leading too far out, leading the organization where the users don't want to go, which is the old style, right? Here, we just implemented this and now use it, and they say we're not using this. So there's got to be that balance. We see value in RTLS. It seems unquestionable that there's some value there. Anyway, your thoughts on what you're seeing here?
Yeah, so it's as I mentioned earlier, we've seen a lot of pockets of RTLS out in the enterprise because of our acquisitions, and there are a lot of potential use cases that many across the enterprise believe RTLS can help solve. But when as we've begun to bring all of this together, as I think many good IT shops would do, is to sort of take a look at the whole the sort of the platform, not the platform, but the solution across the enterprise, and say, well, how much is it really costing me across the enterprise when we look at all of this in total? And and that was one of the first things we actually did. We looked at all of the RTLS technologies that were out there, and we collected the capex and opex of all of those and said, well, here's the total that we're spending right now. And of course, the first question is if we were to consolidate that into a single platform or vendor, could we see some level of savings or rationalization of not just the technology but the expense? And then so that was sort of question number one. Then the second question is what are all the different use cases that that our enterprise is actually using it for, and can one or two actually address those use cases, right? So I think I mentioned the big buckets at the beginning. We found folks or units that were using it for asset tracking. We found some using it for environmental monitoring, like temp monitoring. There was a desire to use it for staff safety. And there wasn't, currently an implementation of that, or at least at that point. And then there was a desire to use it for optimizing staff and patient flow, as we had sort of just early talked about. And so, each of those has a potential ROI. And what we found, quite honestly, was, it was a little difficult to really sort of create hard savings or hard benefits from those. I mean, we started to impute or sort of estimate what it could be. For staff safety, for example, we were sort of looking at, well, days away or out of work, what's the cost of, what's the average amount of days that a person that might be traumatized from an incident or injured because of an incident, what would the estimate of days out of work be, and what would that cost? What's the cost of workers' comp as a result of that? So, I guess my point is, at some level, the ROI for RTLS isn't an exact science. Obviously, with asset tracking, I think you can find some more sort of hard numbers, irrecoverable equipment loss, for example, or loss of productivity because they're looking for devices. But that's not the only use case that's out there, is the point. And so we're looking for ways to be able to rationalize and make those estimates. But I think it is a challenge. It's not necessarily an inexpensive technology, depending on the precision, as we talked about earlier. I think making the cost and the benefit meet with a payback of less than a couple of years is still kind of, at least in my experience, it's still sort of an open question. So, I would sort of punt it to my colleagues to ask them what they've seen as payback in that regard. But from us, it hasn't been an immediate payback necessarily. It's 3, 4, 5 years out, depending on the use case that we're looking at.
All right, well, let's go to our colleagues here, our co-panelists. Neil, do you have any thoughts around this whole concept of ROI?
I love this question because it's such a challenging one. And as I communicate with a lot of healthcare executives who are making buying decisions, there's sort of two buckets. And again, with the risk of oversimplifying, there's the bucket that says, hey, I need a nurse scheduling solution. So I have budget for that. I can go out to RFP and pick the best nurse scheduling solution for my organization. And then there's the bucket that says, this solution can actually drive efficiencies, but it's not like a bucket where we have to have something, that we already have budget in place. And that second bucket is often where many of these workflow enhancements, and as you've said it, kind of removing the pebbles from the shoe, some of these elements, and generally that second bucket comes very much down to the R of the ROI equation. Like if I make this investment, what am I getting out of it that is over and above my investment? So this is it's such a critical question, and it's a challenging one. I mean, we love to use like length of stay and AR days and some of these measurable items in healthcare, which appropriately so. But there are elements like nurse turnover that I think can be really useful measures of some solutions that take a long time to get returns. But we should start measuring some of these elements so that we can talk about, hey, a good nurse duress plus nurse workload balancing plus nurse automatic call cancellation actually has a measurable impact on nurse retention. We're not great today at measuring some of the elements like that. I think we can be more creative, and I actually think this is a place where KLAS can be helpful, is to think about some measures of return that maybe aren't the same ones that we've been thinking about for a long time. But I also do believe that there are items like room utilization. Teresa mentioned operating rooms, exam rooms, infusion chairs. If we can improve utilization of those through some of these workflow enhancements, that's a return that could be measured and could be impactful and be able to kind of share with executives who are making these tough spending decisions. This is the impact we think we can get because it's been validated in other places. So I think that we, as an industry, and again, I think that we have a bit of a role here, and I'm thinking deeply about how do we measure that, validate it, and then, share with the market so that intelligent decisions can be made.
Teresa, it sounds like it maybe depends on the use case, that for the asset tracking stuff, it may be pretty clear. You can run numbers there around things you found, but also spending avoidance, meaning we would have bought another device, but we were able to find this one and we didn't have to. So, and then the soft benefits, the more difficult ones to quantify, the one around nurse call, distress type thing. I mean, my wife's a nurse practitioner, and I would imagine she was a nurse for many years. I would imagine being able to call for security knowing they're going to come, they're going to find you wherever you are. That might really be, important for job retention if you were starting to feel unsafe and they gave you something like that. So anyway, your thoughts around the ROI issue?
Yeah, so this is a great one for me, and I'm going to give you a really good example where we have been very successful and easy to measure. I'll give you some background. So there was a recent, and this has been a long-going, kind of focus for executives in healthcare, which is patient experience. A recent, for me, recent 2019 Harvard Business Review article did a really nice job highlighting the correlation between a hospital's patient experience scores and the hospital's profitability. It looked at one specific measure, which is how patients rated their communication with their nurses. This is, these ratings could come in the form of HCAP scores, or many, I would say probably about 95% of the hospitals in the US today use Press Ganey to measure these. So within that category of nurse communication, there are several questions that measure, was the care, in the essence of it is, was the caregiver in the right place at the right time to provide the care that the patient perceived as accurate? A metric that can be improved by leveraging the data from RTLS and staff locating. So the study really provides you the formula for this ROI in a very quick, easy to follow format. The study concluded that if there is a 5-point increase over time in your hospital ratings associated with this question, then there is a correlation with a 1 to 2% increase in profit margin. And there's been other studies that have loosely, measured that association, but this one really puts some good information behind it. And this is why many healthcare executives are bonused on patient experience. Good patient experience brings better patients, better doctors, more money. So from a clinical perspective, and the literature says that rounding is key to improving these patient experience and outcomes, right? So if I have eyes on my patient more often throughout the day, I am anticipating their needs. So there's less need for them to call me. I'm addressing their issues before they even, need to wait around for a nurse to be able to get there. And it is tied to better outcomes, because more times with eyes on the patient equals better outcomes. I've worked with multiple hospital systems specifically on their rounding initiatives, utilizing RTLS for staff locating with nurse call integration. I go back to this nurse call integration because it's such a bang for the buck, to really help drive rounding activities, whether it's, that they have a dashboard that's showing when was the last round and when is the next one due, whether it's a dome light that indicates that a round is due, whether it's the reports that on the back end, you're able to track and see how you're trending towards, these rounding initiatives. The idea is that if your staff is proactively rounding, the results will come. And in many of these implementations where we've done this, we have seen a considerable increase in their patient scores, up to 10 points, which according to the Harvard Business Review article, this would equate to an increase of 2 to 4% in profit margin. That's substantial. That would pay off, Joel, your system in like 6 months, right? So I was excited when this article came out, because then it makes the formula so much easier. Now all you have to do is say and prove out that rounding does increase. And I'm here to say, I've seen it over and over. It does increase your patient experience scores. So that's a good example I always like to use.
All right, excellent. We're going to take some questions from the audience. Teresa, this is probably going to be for you. Any plans to better manage and monitor battery status on the tags through the application? Does that question make sense to you?
Absolutely.
Oh, good.
We currently have that within our system. So we have a whole battery management software that lets you know what's the life of the batteries, and are they running out, and who's low on battery. We've also developed a way for staff to check their own battery life, a variety of different ways. One that will send a text to their phone, another one where they could go to a station per se and press their button, and it will tell them the battery life. So from a clinical perspective, I'm very cognizant, very aware that, you know, technology needs to be working at its optimum all the time for clinicians, for them to trust it. And battery life is one of those measures that we need to make sure that we have accurate battery life and that the batteries are working. On assets, it's a little different, right? You'll see, because you'll know that the asset is no longer being located. That's a little too late, but it's still important to monitor those batteries, but more so when you have it on staff, because you want them to buy into that, the purpose of the technology.
All right, I got to bring another one to you, Teresa. Got some technical questions here. I feel like
Whoa.
you're the one for these.
Clinical, technical, or just purely technical?
Well, let's see. Let's see. You can always punt it if you want. Regarding advanced use cases, what role do you see RTLS playing in device utilization reporting and management when leveraged at higher levels?
Sure. So, interesting enough, I helped a very large health system implement asset tracking because I was local. And although I have some experience with asset tracking, being more clinical, not so much. But it turns out that asset tracking is as clinical as everything else. So in this health system, clinicians are looking for their devices. They are monitoring PAR levels, very much so in specific areas. A very busy trauma center, so in their ERs and in their ORs, they cannot go below a certain number of pumps. So it is very important to not only think about asset tracking from you know, where's my asset? Can I PM it? And where can I find it so that it doesn't walk out the door? But the utilization of it on a daily basis. Do the clinicians have it when they need it at the right time in the right place? Is extremely important, going back to staff retention. It doesn't stop us, the clinicians, from hoarding, because we always think that that's the last pump that's going to be available. But it does give them a level of certainty to have maybe perhaps even a mobile app to see where the location of the devices are that they're going to need throughout their day.
All right. Sorry, gentlemen, but Teresa's up again. I will give you a final thought here. Teresa, I have a significant ongoing deployment of Sonitor infrastructure. What is the go-forward strategy around powering devices, batteries versus PoE? What is the market feedback? Batteries are important.
Yeah, so the main difference there's a couple of main differences. Speed to deployment. So when you have, and again, we have a lot less devices than most RTLS companies out there. So we're going to have one device per room that can cover and split the room into 4 areas. So you just need one. And so speed to deployment, right? So if you have battery, it's much quicker. You don't have to empty out the room. It is hung on the grids of the ceiling, so easy to install, less than 15 to 20 minutes. The benefit, then, you know, the kind of the perceived con to that is you have to manage batteries. We have many customers that have dedicated staff. We also offer a battery management program where we would provide that for our customers. The benefit to PoE is just that you don't have to manage batteries. But it depends on the situation and on the healthcare system and how quickly you want to deploy. The battery life on many of the devices can be up to 5, 6, 7 years. You'd probably pay that, you know, 10 times over if you did a full PoE connection into every room.
Excellent. Okay, very good. Have you ever seen RTLS being utilized outside of a building, particularly for duress calls in parking lots or in organization grounds? Teresa?
Yes, I actually am working with a customer right now on this. Because of our unique technology utilizing mobile, the ultrasound from the speaker, we can locate anybody with a mobile, and we use the mobile for BLE kind of web when you're outside, outdoors, wearing a wearable, right? Because you don't always have, and usually when we see this is for duress. So let me make sure we know what the use case is. So a caregiver is outdoors, they're in a parking garage, they're in a duress situation. Not always can they reach out to the phone, so they have their wearable that connects to the phone via Bluetooth, and we could utilize that um, as locating for duress specifically.
All right, I want to make note that every one of those questions was from somebody at a hospital or health system. So they were not softballs, they were not setups, and they just happen to all be really appropriate for Teresa. We're going to do a lightning round of final thoughts. Let me frame it up this way. Joel, we're going to go to you first. This seems to me like a technology, as a CIO, you had better at least know about, understand the potential value, do your research. Um, Probably you should be doing something around asset tracking at the very least, but there's way too much. You have to know what's going on here. I mean, most CIOs worth their weight are going to have done something with RTLS, don't you think, Joel?
Yeah, for sure. And I think, look, like I said at the beginning, our vision is making sure that we're the most trusted and personalized coordinated care. And to be able to do that, you really need to know where everything in your organization is moving. And so, if it's not just assets, it's also patients, it's also providers and nurses. So, ultimately, whatever we end up leveraging in the future, which is probably going to be some form or fashion of RTLS, you need that technology to be able to understand organizationally how things are moving and flowing. And without that kind of sensing or monitoring capability, you're not going to have the data to be able to really improve your operations. And I think at the end of the day, that's what we're trying to do, is deliver care better. And it starts with how we operate.
Yeah, you can't just be doing nothing in this area. There's too much upside for everything CIOs are responsible for. So very good, Neil. Your final thought, based on what KLAS does in this space, your knowledge of what's going on in this space, your best advice for the CIO types listening.
Yeah, two thoughts. One is carefully look. Everybody will talk technology, and appropriately so in RTLS. We've realized that a lot of the impact is around how good of a partner these solutions are, and so as you're looking at new solutions, and Sonitor, we mentioned, was one best in class this year. They've proven to be good partners based on the data we've collected. Ask careful questions about how they will help you with adoption, change management, etc., about how organizations, the vendor will be a good partner with you in helping roll these out. And I think the second piece is we haven't hit data a lot. Teresa brought it up early, and Joel did as well. But we had a summit in Park City last year where one of the CIOs said, hey, real time's great, but sometimes it's too late. And what he was saying was, how can this data help us make decisions before the fact? So how can we take all of this wonderful RTLS data and turn it into really impactful predictive analytics that can help us be a more intelligent organization? I think is a really useful use of RTLS that we haven't maybe spent as much time on today.
Awesome. Teresa, final thought. I know we didn't even have time really to get into all the adoption change management stuff, which, as Neil said, is important, but your best final piece of advice for the CIOs listening out there.
Yeah, so AI is in the forefront, right? Make sure that your RTLS vendor is providing the cleanest, most accurate data, because when I ran AI programs back when they started, garbage in, garbage out. So you want to make sure that that data, and RTLS provides, the location, time, and proximity. Those are variables that really add value to the AI platforms that are being used in healthcare today. And lastly, very excited about our new platform that can help facilitate that pick your accuracy, pick your tag approach, which I truly feel will allow hospitals to afford to tag everyone and tag everything that can improve care delivery. To Neil's point, visibility is key to operational excellence.
Wow, that was great. That was amazing. That was a lot of excellent information. Regarding continuing education, you can use the final slide in this deck. You'll get an email when the on-demand recording is ready for viewing. If you want to work with us, you can reach out to Nancy Wilcox from our team and go to our website to register for upcoming panels. With that, I want to thank our tremendous panel, Joel Vengco, Niel Oscarson, Teresa Brasac, and Sonitor for sponsoring, and you for attending. With that, everyone have a wonderful day. Thank you.
Thanks, Anthony.